Welcome to this session on somatic tracking. So of all the interventions that I use with clients, the single most effective tool I use is somatic tracking. So somatic tracking is in many ways the heart of cognizance pain management. It's the most powerful tool that I use to untangle sensations from fear and rewiring pain pathways so that neutral sensations no longer result in the feeling of pain. So at its core, this idea of somatic tracking is about relating to your current physical experience with a sense of real curiosity and attention. Somatic tracking will help you get to know your own nervous system and build a real sense of resilience and strengthen your foundation of safety. So when experiencing pain, if you can just find a quiet and private space, somewhere where you can relax for around 20 minutes. So first of all, choose a comfortable position. So whether it's sitting or lying down. It's important to note that it's okay to feel some physical discomfort during this exercise. You don't need to force yourself into perfect comfort, as it were, but it's important to avoid kind of any unnecessary strain. So first off, we're going to start with an imaginary exploration exercise. So this is what I've termed as the Spaceman somatic tracking exercise. So firstly, I invite you to close your eyes, and if you can visualize yourself as an astronaut venturing into a new galaxy. So this galaxy represents your body, strengthening from the top of your head to the tips of your toes. So your mission here is to explore it, sensation by sensation, observing everything that you encounter so you can report your findings back to mission control. So start by securing your space helmet and prepare for your journey. With your inner awareness, begin by scanning your body, the new galaxy from head to toe. So I want you to pay attention to every sensation you discover along the way. You might have preconceived notions of what you find based on your past experiences. But remember, this galaxy is unexplored and it's unique. So set aside any of those expectations that you have and focus on observing what is generally present in this moment. So we're going to start by diving into those body sensations. So start by scanning your body. So noticing where the sensations feel most intense. What part of your body demands the attention most? If you sense multiple areas of focus, simply choose one. There is no wrong answer or choice. Just concentrate on that area, bringing a curious awareness to the sensation and examining that more closely. So you can let your sense of touch guide your exploration. How would you describe this sensation? Is it hard or soft? Is it tight or loose? Sharp or dull? Rough or smooth? So spend time observing these details. Consider its size and shape. Does it have a sense of pressure? If so, is the pressure moving inward, outward, forward, backwards, or to the sides? Whatever you observe, remind yourself that this is merely a sensation. There is no danger in this. There is nothing to fear. You are safe. Now I want you to look at evaluating and breathing into these sensations you feel. So on a scale of 0 to 10, how unpleasant does this sensation feel? Next, assess how much distress or resistance to the sensation can you feel. Also, on a scale from 0 to 10, where in your body do you notice that sensation? Now, take a deep breath into the sensation. As you exhale, release this tension. So this isn't about forcing the sensation to disappear or change. Instead, your goal here is to breathe greater clarity and breathe into the experience. As you inhale, allow your breath to fill the sensations with a gentle sense of awareness. As you exhale, feel the air naturally leaving the body. Let this rhythmic breathing help you feel grounded and at ease. I want you to continue this process with a sense of openness and safety and spaciousness in this experience. You don't need to observe every single detail or force anything in particular. Simply let your awareness rest on the sensations, allowing them to exist just as they are. Be present and be curious about these sensations. Continue to do this, breathing 5 times over. After taking 5 deep breaths, check back in with the sensation. What do you notice? Has it shifted or changed in any way? Is it softer or firmer than before? Is it sharper or more muted? Smoother or rougher? On a scale of 0 to 10, how unpleasant is the sensation now? Similarly, on a scale of 0 to 10, how much resistance or discomfort do you feel towards it? Remember, there are no right or wrong answers to these questions. Your only task is to notice what is happening, whatever this may be. Can you identify the center of the sensation? The spot where it feels most intense? If so, direct your attention here. Then expand your focus to the outer edge of the sensation. How, for example, does the edge compare to the center? Is it softer or firmer? Is it smoother or rougher? Looser or tighter? Perhaps it's warmer or cooler, or even more open or denser. Whatever you observe, simply acknowledge it as it is. Take a few deep breaths and breathe into that sensation. Bringing awareness to it. You are not trying to fix anything. You're not trying to alter or change anything. Your goal here is simply to stay present with it, allowing the sensation to exist just as it is. I want you to imagine yourself as if you're an explorer of a galaxy. Your role is simply to observe and learn. Continue this deep breathing as you explore this sensation. So congratulations, you've now completed your first somatic tracking session. As you continue practicing, remember that the exact characteristics of a sensation, whether it's hard or soft, large or small, shifting or steady, pleasant or unpleasant, don't really matter. What's important is the process of observing and understanding the sensations you're experiencing, allowing your brain to shift into that state of real curiosity. This exploration is about connecting with the sensation as it exists in this moment. With all its unique shapes, sizes and textures. As you deepen your practice, you may notice that painful sensations change, lessen in intensity, or even fade away completely. However, the purpose of somatic tracking isn't about making pain disappear right now. Instead, the goal is to retrain your brain to reinterpret sensations through a lens of safety. This essentially works on breaking that pain-fear cycle that perpetuates a sense of chronic discomfort. So over time, this approach helps reduce neuroplastic pain. Whether or not the current sensation diminishes or not isn't the point. What truly matters is that you engage with the sensation through curiosity instead of resistance. This process opens the door to a healthier and more mindful relationship with your body. So there's no need to worry about doing somatic tracking perfectly, as long as you are approaching the sensations with curiosity and focusing on safety. You're doing things and you're moving along the right path. Over time, you may want to move away from following this structured routine and let your own sense of curiosity guide your approach. Somatic tracking is a lifelong practice, and like any new skill, it will become easier with the more that you do it. So before we end this session, I've got some special tips for headaches and migraines. So firstly, headaches don't have to control your life. But because headaches and head pain often behave in a very unpredictable way, I've got some specific tips here for you for applying somatic tracking to headaches and mindfulness. So the first thing to do is to practice somatic tracking when you are pain-free. Although it's really, really valuable to engage in somatic tracking during a headache, it can also be helpful when you're not experiencing pain. Many people with frequent headaches notice subtle sensations around their head or neck even before a full-blown headache or migraine occurs. Using somatic tracking during these moments of mild sensation can offer an insight and reduce the likelihood of an escalation into a full-blown headache. So I advise to take a more light-hearted, playful approach during your somatic tracking sessions. So the better and the more you engage with this approach, the more likely it is to be successful. So incorporating this sense of playfulness or warmth, such as imagining yourself as a curious little spaceman exploring your body, can make it easier for your brain to engage with sensations in a way that feels safe and not threatening. So with headaches, initially it can be helpful to breathe into your belly, not the sensation itself. So for most types of pain, the Spaceman somatic exercise suggests exploring the idea of breathing into the sensation. However, when dealing with sensations in your head and neck, this approach can and sometimes does lead to shallow breathing, which may inadvertently activate your sympathetic nervous system. So that's your fight or flight response, also known as that sort of danger mode response. So instead, if you're focusing on sensations in your head or neck, take 5 deep breaths into your belly rather than directly into the sensations. Once you've completed these belly breaths, then you can shift your awareness back to the sensations in your head and neck. So be curious about these early sensory signs of migraine. Many of us recognize early warning signs that a migraine may be coming, such as a tightness in the neck, throbbing at the temples, changing in vision, or even unusual taste on the tongue. These signals often trigger a sense of fear or dread, worrying about an impending migraine, debating whether to take medication, or feeling anxious about how it might disrupt your day. However, responding to these signs with a sense of curiosity instead of fear can help. Fear often transforms these harmless sensory signals into full-blown migraines. So the next time you notice what you think of at the start as a migraine, try using a somatic tracking approach to these sensations with a sense of curiosity and safety. The more you view these early signals as safe, the less likely they are to escalate into the pain you've been conditioned to fear. So making somatic tracking a regular habit is important. If your pain primarily occurs when standing or moving, adapt the exercise by performing it in different postures rather than in a seated or relaxed position. For those with daily pain, I recommend practicing somatic tracking once a day for at least 10 days to build a habit. If your pain is intermittent, try somatic tracking during episodes of pain at least 10 times. While this may feel like a significant time commitment, it's a worthwhile investment. If you're going to experience pain, you might as well use these moments to retrain your brain and reinforce the healthier neural pathways that we're trying to create. So that concludes this session on somatic tracking. But remember, the goal isn't to get rid of pain in the moment, it's to change your relationship with it over time. With consistent practice, you are teaching your brain that these sensations are safe, they're not dangerous, helping turn down the volume of pain. Be patient, remember to be kind to yourself, and keep up a consistent practice.